What's going on, everybody? My name is Kenneth Rivera. Thank you for tuning in to my presentation, Physician Assistant in the Military. The Inter-Service Physician Assistant Program, or IPAP, has been a personal pursuit of mine since I have first learned about it a couple of years back in my military career. IPAP is the premier choice for military members looking to transition from the enlisted ranks to the officer ranks in the military medical field. I'm going to be covering the following topics in my presentation. Please grab some popcorn, sit back, relax, and enjoy the show. What is a PA? PAs are healthcare providers who practice medicine. They are in charge of people's wellness, much like doctors. They can order lab tests, perform procedures, assist in surgeries, and even prescribe medication. You can go to the link below for an in-depth look of PAs as a profession according to the American Academy of PAs. PAs were the product of demand for greater healthcare access, especially for the nation's poorer citizens. The profession was the creative solution for the nation's shortage of primary care physicians. The first students were 4 Navy corpsmen who received extensive medical training during their military career in the 60s. Then in the 70s, the career field gained federal backing and acceptance, which trickled down into civilian practice. How does one become a PA in the military? There are 2 ways. One's entering the military already as a PA graduate with a master's degree. Rank will be determined by the years of experience in the civilian practice. The other way is through IPAP, which I will focus on. You need to be an E3 or above with military years of service, not to exceed 14 years. Have at least 60 semester hours of college coursework and take the prerequisite core science and math classes with an average GPA of 2.85 or above. The whole person concept also applies. You need to have a good track record and be recommended by your superiors. Once accepted, you will retain your pay grade for the duration of the school. Imagine this, actually getting paid to go to school while being debt-free. Sign me up. How does one make a living as a PA? According to Healthcare Traveler, census shows that practicing PAs reached short of 85,000 in 2010, a 100% increase 10 years before that. There is also a job expectation growth of 30% after 2020 and a practicing population of 244,000 by 2025. The average annual salary of PA starts at $60,000 up to 6 figures depending on experience and location, even sometimes rivaling a doctor's average annual salary. What roles do PAs play in the medical field? Studies show that with the increased allocation of patients to PAs, there is little to no evidence that there is quality of care compromise. Patients handled by PAs in collaboration with medical doctors provided greater benefits, including decreased length of stay of patients in the facility. But what about mainstream acceptance? A survey conducted by the Association of American Medical Colleges showed that about half of patients actually preferred to be seen by a PA instead of waiting for a medical doctor to be available. This shows that the stigma of inferior medical care of PAs are slowly but surely being shattered, and the public trust is massively gained. Although many barriers still exist, this is a step in the right direction.
So why do it? I'm not going to sit here and lecture about American patriotism. This country has given me and my family so much, and this is my way to give back. Also, being part of a cause greater than myself is a special feeling. Pursuing this dream has helped me develop as a leader and a family man. Most of all, the Air Force has forced me to grow personally and professionally for the better.
This concludes my presentation. Answer the following topics and hopefully solidify that IPAP is the premier choice for military members looking to transition from enlisted ranks to officer ranks in the military medical field. Or not, because I don't want any competition when I apply. Just kidding. Thank you guys for tuning in.